Yes, I got to start from the open mic session.
Can. Even I also have to do that sometimes, just to get myself exposed.
And Tom going to help me with the lyrics as well,
yeah,
right?
just to gain some exposure there. Now we are talking about the big C. Apparently there's a lot of big C's and different versions of big C's out there.
This is the double C.
The double C.
Double C.
CC. Colorectal cancer, right? So we'd like to welcome Dr. Lam Seng, who is a consultant oncologist at the Pantai Hospital, Kuala Lumpur. Good morning, Dr. Lam.
Good morning.
Good morning, doctor. All right, so maybe you can share with us how prevalent is colorectal cancer and where does it stand in the top 10 list of cancer in Malaysia?
Yeah.
Well, at the moment, I think it's about the 4th or the 5th most common cancers in Malaysia. It's different compared to the Western world.
Okay.
The incidence in Malaysia, on an average, is about 11 to about 15 to 100,000. Compared to the West, it's about 40 to 100,000. All right, but the cancer registry in Malaysia is actually pretty new. If you look at the cancer registry in Malaysia, what we have, you divide them into ethnic group. The Malays have a risk of about 45 to 100,000. The Indians has about that 45 to 100,000. But the Chinese ethnic group has highest. It's about 20 to 100,000.
Ooh, so I am more at risk for colorectal cancer than compared to you.
What about in terms of men and women, the gender?
Generally, the men is actually more than women. On average, about 3:1.
So can we pinpoint it to the food
or lifestyle, or what would be the main causes?
I think then we look at really, what are the possible contributing factors to one getting colorectal cancer. Generally, if you have high intake of red meat, right, then you run a risk 4 to 5 times more than somebody who takes less or in moderation. Obesity is also another risk factors that actually could contribute to more the colorectal. Smoking is could actually increase your risk. If you have a 20 pack cigarettes, you actually have a risk of getting a polyp or an adenoma. If you have 35 packs cigarettes per year, then you actually run the risk of getting colon cancer, right? So exercise in moderation is certainly always encouraged, right? Somebody who doesn't, then obviously you also run a risk. Now, higher intakes of fibers, vegetables, obviously could actually reduce your risk. But it doesn't mean that if you're on a vegetarian diet, you don't get colorectal cancer. So that's not proven yet, you see.
So, yeah, okay. What about the symptoms? What should we look out for? How can we tell?
Right, colorectal cancers can actually prevent. Sometimes it's so quiet that somebody actually feels tired. And you actually go and do a blood test and you find that the patient is actually anemic, lack of blood. And the next thing they actually investigate, why is this person who's being normal actually having lack of blood? So you do a colonoscopy, and that's where sometimes a lot of time you pick up growth in the colon, and that could be so subtle as actually leaking blood each time when they pass stools.
And they don't even know it, right?
That's right.
Because it's so little.
Conversely, then you get some who have symptoms, right? Altered bowel habits is something very common. So if you say, if you do it every day on a normal daily basis, and now you find yourself constipated, you go 2 or 3 times, or even, you go 2 or 3 days and you go once, which is not your normal self. That should prompt you to actually visit a gastroenterologist or do a colonoscopy to rule out. Sometimes they delay the symptoms, right? And they actually get into what we call as overflow diarrhea. So in other words, what they get is actually more frequent stools being passed in a day than the normal self. Or some even present obstructed, right? Vomiting, the bowels are not opening, present with a distended tummy, and the next thing you know, they actually had growth in the colon.
What about those with IBS, irritable bowel syndrome? Are they also at risk of getting colorectal cancer?
Yeah, they run the risk as well, although the risk is compared to general population certainly, right? Ulcerative colitis is the other people who actually run the risk. The hereditary part is actually contributing colorectal cancer, although are there, but they're small.
Right.
Fortunately, a lot of colorectal cancers happen more in the sporadic, So the hereditary part is actually small. So it contributes like less than 5 or even 10% of patients who actually present with colorectal cancers. So usually it's sporadic. The age group really increases with incidence, right, as you get older. right? So in about the 5th, 6th decade of life, that's where most of these patients actually present.
So 50 to 60.
That's right.
All right. So when the symptoms that you just mentioned just now present itself, would it be at a late stage already?
Some of them could present in a very early stage, right? Feeling altered bowel habits or even passing blood in the stools.
Okay.
If they go and see a doctor earlier, that's where you can detect them early. So I think the bottom line is really, if you have any symptoms which is not normal to yourself, don't delay. A lot of time what we get is patients think that it's just hemorrhoids, piles. Right?
Yes.
So, traditional treatment do come with the picture, and that's where they normally tend to go first, For some, they are fearful of finding the real facts, right? And they delay and think that, well, probably something that they add. But I think we have to be aware, that these cancers can actually be so quiet. Early detection offers you the best chance of a cure.
But those with hemorrhoids or piles, are they also at risk of getting this colorectal cancer?
No.
No.
They're just different.
Different altogether, right?
That's right.
But the symptoms may be...
Mimics.
It mimics.
So you can confuse. You think, oh, it's just piles and don't do anything.
Then they go through different treatments.
That's right.
Which is different, which is wrong.
Okay, let's perhaps go into the treatment.
Yeah.
You can share with us what can be done.
Firstly, it all depends on the stage, all right? Obviously, the most important thing is if they present early, then surgery is the best options for a possible cure.
Yeah.
Following surgery is that when you look at the histology report and you look at whether tumors, at which stage they're affected. If you're stage 1, a lot of time, we don't need to do anything else because the 5-year survival rate can reach as good as 90%. And these patients are generally follow-up. If you get stage 2 and 3, then especially in stage 3, you need what we call an adjuvant treatment. These are add-on treatment following the surgery. It's different for colon, it's different for rectum. If you have colon, somebody presents with stage 3, i.e. lymph nodes are involved, telling us that the tumor cells actually begin to spread to the regional lymph nodes. Then these tumors have a potential to spread elsewhere. Usually these patients go through what we call a staging investigation that includes the CT scans to look for possible spread elsewhere. If you're confirmed they don't spread elsewhere, the next thing you need to do in colon cancer is actually chemotherapy. In rectum, some of these patients require is radiotherapy. Radiotherapy is just giving high energy X-rays to the bottom part to reduce the possible of a local recurrence. Whereas the chemotherapy is a systemic treatment to reduce the risk of a distant spread of this tumor. When you get to stage 4, obviously a lot of time these patients cannot be cured. If you look at the statistics, 5-year survival rate of these patients are less than 5%. All right? Now these patients a lot of time present with spread of these tumors to other organs. Now it's important to understand if you get a colorectal tumor in primary, if they spread to the liver, a lot of time the general public tends to associate has this getting liver cancer, but it's not. It's actually the primary cells in the colon or the rectum which are spread to the liver, and those cells are actually proliferating in the liver. So, it's a stage 4 tumor, and you treat them as their colorectal cancer. These treatments essentially are palliative. In other words, you try to prolong the survival of these patients for as long as you can, but with best quality of life. Now, with newer drugs now being available, what we call as targeted drugs, this is now actually achievable, and a lot of patients actually gone on to live beyond. The older days is, 2 years. Nowadays, we actually extend survival of these patients. And a small subset of patients can actually get a complete remission of the tumor and live beyond 5 years.
Right.
I think that's something to be very clear, and we need to know that there's a lot of hope and treatment available.
So it's a basic, saying that the earlier you go for your checkups and all that, or the earlier that you go for treatments, the higher the chances of survival.
Cure.
It's true.
And also cure.
Absolutely.
But
Right.
in terms of colorectal cancer, will there be also a relapse?
Well, absolutely. I mean, if you look at the statistics again, if you get a stage 1, you can argue 1 to higher survival rate being 100%. I'm afraid it's not, because why? Now, tumor biology, there's a heterogeneity of it. In other words, if you take 10 patients with all colon cancers, and you find that the growth pattern, all of them are actually different. They're not the same. So some tumor cells are more aggressive, some are less. Now, the more aggressive tumors, although they may be in early stage, there's some who are actually so aggressive they actually could spread to elsewhere. All right, it may have happened even right at the time of doing diagnosis, but it's just that all their scans don't show it. All right, so when these patients actually get a recurrent, all right, that's where you get these patients relapse. Now, the relapse may not happen in the local area whereby the colon is, but it may spread elsewhere and present as distant metastasis, on relapse.
Okay, if there are some viewers out there who think that, they don't have any of the symptoms you mentioned, but they're just playing safe.
Right.
Is regular screening out of nothing necessary?
What happened over the last 4 to 5, as a matter of fact, more than 10 years, countries like in Norway, UK, and also in the Italian group, what they then look at, actually, if you get about half of these patients, in colorectal cancers tend to occur in the rectal sigmoid, that means the lower part of the colon and the rectum, could actually detecting them early provide a better outcome. Now, 3 countries did what called a randomized controlled trial, and they collected groups of patients aged between 55 to 64, and they offered them flexible sigmoidoscopy. It's not a colonoscopy that you examine the whole colon. It's actually a segment of it.
I see.
And what they show that can now reduce the incidence of colorectal cancer, and more so important, the mortality of colorectal cancer by up to even 20 to 30%.
Right.
So I think they will eventually advocate this as one of the early screening method to help to detect early colorectal cancer, and whereby when you detect them early, you can actually, reduce your risk of distant failure, offer yourself a good possibility of a cure. So I think it is actually important to keep this in mind. When you're at this age group, think about doing a flexible sigmoidoscopy, if not a colonoscopy. Perhaps it could help you to detect them early.
Wonderful. Do you have any words of advice or parting words before we conclude the show, Doctor? To the viewers out there.
I think we firstly have to be aware that colorectal cancers can actually present silently, right? And if you have symptoms that persist for 2 weeks or even longer, please go and see a doctor. Get it sorted out. Don't assume. And if you had some treatment and that treatment doesn't go away, doesn't help the symptoms go away, really go sort it out. And early detection provides you the best possibility of a cure.
Okay, early detection is the key there. So
that's right.
Be sure to get your screenings and everything all checked up.
That's
then
right.
After you can join the One Malaysia KL Heritage Expo race.
2 tests for you today, right? HIV test as well. See, colorectal cancer.
That's right.
Colonoscopy or the other scopy.
All the scopies. We hope you enjoy watching the show today.
Thank you,
Zamil
Doctor.
and Stephen signing off for the day, and we wish you a pleasant day ahead. Take care, everyone. Join us at same time, same place tomorrow.
See you guys.
Take care.
Bye.